to start.
All right. Well, thank you for letting me speak to this group today about this new initiative that is getting started here in South Carolina. Through a lot of work and a lot of hours and a lot of collaborative joint work, we are actually making some really good strides and progress on getting this Palmetto Birth Band off the ground. So our objectives today, I'm going to introduce you to the Maternal Health Innovation Collaborative. Most of you have probably heard about this or grant funding, so it's just going to be a brief review of that. Kind of what is the why behind the postpartum alert bracelet? What is our specific band project? And then the big question is always, when am I going to get these bands? And so I want to talk to you about all of that today. So the Maternal Health Innovation Collaborative, South Carolina DPH was awarded a 5-year grant from HRSA that started in September of 2023, and it will run through August of 2028. And really the overall purpose of the MHI program is to reduce maternal mortality and severe maternal morbidity. The goals are to improve access to care that is comprehensive and high quality throughout the entire pregnancy through postpartum period. So from preconception to postpartum. We hoped to enhance state maternal health surveillance and data capacity, and then identify and implement some innovative interventions is really kind of the ultimate goal. You can, I thought I put the link on here, but I can share that later to see the strategic plan, or you can just go to South Carolina DPH and look for the Maternal Health Innovation Collaborative Strategic Plan. So through this work, we have really these 4 major collaborative goals. One is to focus on the maternal health service delivery. So that's ensuring that we have maternal health care statewide. We want to expand access to services. We want to make sure that we have good community collaboration and really build a robust, effective healthcare system and really address those areas of maternity deserts that we have in our state. Next is the data collection, analysis, and distribution. And I will just show you a quick peek at the capacity for the data building that we have. And this is a lot through the work done by IFS. And then the maternal health workforce development is really strengthening our workforce through collaboration and capacity building, and then enhancing those training opportunities for healthcare providers and birth workers in the state of South Carolina. So we really want to make sure that we have the capacity to bring more obstetric care into those maternal health deserts for our state. And lastly is maternal health empowerment and literacy. So we're really wanting to equip our healthcare providers and other organizations that support maternal health and perinatal care to make sure that the patients that we serve have the understanding of what is going on with them, understanding their health conditions, and empowering them to make informed decisions, as well as recognize early warning signs of complications that may be occurring for them in their pregnancy and postpartum period. So just a quick glance at some of the innovative projects that we have going on. First is our data. And so the Empower Hub, if you have not been on this website, I highly recommend that you take some time to dig through all of the different information that is available through the Empower website. I put the link, it's empower-palmetto.sc.edu. So that's kind of the head page. This is the centering or the voices of family and partners. And so there's a ton of information from the Voices program that you guys have heard about in the past on other echoes. The Essential Maternal Resources provides us lots of information for our patients. So there's a landing page for them to go to. And this we'll circle back to when we start talking about the bands, because this is how our pilot program is going to register their bands. And then there's also on that tab all kinds of information. I just did a small screenshot. I could not get them all in on one page. And then if you're interested in our data in South Carolina, this is our interactive dashboard. This is just a quick screenshot. As you can see, there's a ton of information. And what is really great about this is that it goes down to the zip code level. So you can really focus in and see, what resources are available, what's really missing in that area, what are our birth statistics look like in the areas of our state that you're working in. And then there's a page on workforce development, as well as the maternal health story map series. And if you haven't checked that out, I would recommend that you definitely check that out. It's a lot of great information. There are multiple innovative projects going on. Health Evolve has Project Lauren, which is a digital remote monitoring platform / app application. Birth Matters is working on doula support. Williamsburg County has their AIM community care modules. USC Center for Community Health Alignment has some perinatal training for our community health workers and a peer support network pilot. South Carolina State University has the pop-up Mommy Cafe events. We also have our patient engagement studio, which allows us an opportunity to share the innovative projects that we're planning with patients that are similar to the individuals that we're working with in these different projects to get their immediate feedback. Do we need to tweak anything? Does anything really not make sense? What can we do to make this a better program? And then for other innovative programs are our alert bands and emergency training that I'm going to talk to you about today, which is the project that I'm most closely involved with. So just to kind of connect why we are doing this and why did we choose to do the alert bands, we know that in the postpartum period in South Carolina, the majority of our deaths in our pregnancy-related deaths are in the postpartum period. In 2018 to 2021, about 71.2% of those deaths were from day 1 to day 365 after delivery. And then in the newer data from 2022 to 2023, that it adds up to be about 58.3%. So obviously this is a critical time period for our patients. And this year in the 2026 legislative brief, we did the recommendations from the committee, and in the knowledge piece, there is this, I bolded it for you or put it in the red box, that the recommendation is that all hospitals and providers should educate pregnant and postpartum women about the urgent maternal warning signs, including specific treatments that are important to know about. Make sure we have simulation training modules about hemorrhage and hypertension, and that the goal was to implement a statewide postpartum alert bracelet program. So that is just connecting the dots here for us and why we chose to do this program. So what is a postpartum alert bracelet? South Carolina is not the first state to do this program or this type of initiative, but we are excited and we think that this has a really potentially significant impact on our patient population. So it's a visual cue. When a patient is wearing one of these bracelets, it's a bright wristband that immediately tells paramedics, ER staff, other clinicians that this patient has recently delivered. And it should then trigger that they need to think about vital signs differently, that maybe they need to triage them differently, that maybe we need to move them if they're in a non-delivery facility to a delivery facility, or from a level 1 to maybe a level 3 or RPC. With the bracelets, there is specific education that the patients will receive about urgent warning signs so that they can be able to be empowered to advocate for themselves. We also hope that with the postpartum alert bracelet, the patient is going to get faster care, and we can also hopefully prevent misdiagnosis and get appropriate interventions, especially in conditions that may be life-threatening. And then extended awareness. Everybody thinks about the mom, when she's in labor, everybody thinks about that birthing person maybe right after delivery, but the focus often shifts to the baby. And so we want to make sure that everyone is aware that we have risk factors that are important to pay attention to for longer than just while you're in the hospital, that those several weeks, even up to 1 year. So our Palmetto Birth Bands is the program name for our postpartum alert bracelet. So Palmetto Birth stands for Palmetto Awareness to Elevate Maternal Emergencies to Strengthen Outcomes, bracelets identifying risk to her. And so I know that's a mouthful, and I sometimes can't even remember and have to look at my notes to remember what all the letters stand for. But the basic goal is that we really want everyone to recognize there's a name, Palmetto Birth, that has a title, but it is important to know that this is the postpartum alert bracelet. And on the back side of the bracelet, and I included a couple of actual pictures of our bracelets, it says I am postpartum. It's got a medical alert symbol on it, and it has a QR code that's going to go to the landing page for maternal health resources on the Empower Hub. So we tried to include in a very simple way that identifier that we have this alert and we need to be paying attention to what's going on with this individual when they're sitting in front of us, regardless of the care setting that she's in. So we are asking for this program for the birth bands to be worn for 12 weeks. When we looked at the data for when individuals may represent to an urgent care or emergency setting, we thought that 6 weeks wasn't long enough and 1 year was too long to ask a new parent to wear this band. So we settled on 12 weeks. That also included some of those diagnoses for hypertension, infection, hemorrhage, kind of secondary hemorrhages or delayed hemorrhages, some of those kind of situations, cardiomyopathy, things like that, that they would be presenting back in an emergency setting. We have selected, with the help of our 4 regional perinatal centers and the regional systems developers, 1 hospital in each of our regions. So for the Midlands region, which is our peach color in the middle of the state, MUSC Orangeburg was our first pilot site. They have a level 2 nursery. In the blue region and for the upstate, our Piedmont region, Prisma Health Oconee, which also has a level 2 nursery. In the PD region, which is our green, over on the upper part of the coast, we have the McLeod Loris Hospital, which has a level 1 nursery. And then our pink is our Low Country region, and our pilot site for that is going to be Colleton County Hospital, which also has a level 1 nursery. So at those pilot sites, who is going to get a Palmetto Birth Band? All postpartum individuals. So all of our normal healthy deliveries, our normal healthy babies, our preterm babies, our special care babies, our babies that get shipped out to the regional perinatal centers, any of those high risk delivery patients, any babies with fatal anomalies, we give them, even when we anticipate that the baby is going to expire shortly after delivery, our stillbirths, our fetal demises, our pre-viable babies, and our miscarriages. So we want anyone who is considered to be in the postpartum period to receive a band. In order to help give information about these bands, we've developed multiple tools. We have informational posters that we call our public-facing posters, and this has been translated into Spanish. That's the only language that we've translated them into at this point. If we need to translate into other languages, we will. But this gives some information just about what the Palmetto Birth Band is, really explaining what is the postpartum time period, because we have found that the word postpartum tends to have connotations with just postpartum depression. And we want individuals to understand that when we say you are postpartum, it's not just postpartum depression, but that is a specific piece of one of those urgent warning signs that we worry about. But postpartum is the time that your body is healing from that pregnancy and delivery. On this slide too, you can get to the website for both the Empower Hub and the Maternal Health Innovation Collaborative on these posters. These posters are available through DPH, and I can send you the PDF if you would like to print them and have them in your facilities. We also did a poster that is for information for healthcare providers. This we are providing when we go to the emergency departments and EMS trainings as well, because it has a link to the maternal urgent warning sign algorithm, as well as the CDC's Hear Her campaign urgent warning signs. So it just gives some reminders to healthcare providers about what this is and where they can go to get help when they see a patient who has a band on. So what is the patient going to receive? They're going to get education prior to discharge. The hospitals that so far have started giving the bracelets out do it in the postpartum period. They get education. The individual gets education about what does postpartum mean, what are the maternal urgent warning signs, why are they given the band, what is the band for, and then they get a kit. And within the kit, you can see, here's a picture of what our little kits look like. They get the band, they get a magnet with the CDC's urgent warning signs on it. They get a wallet card that when you open the wallet card, I think I have a slide coming up that shows what that looks like, but it has information about the band. And then they get kind of an abbreviated poster. So the individuals at the hospitals, either your postpartum staff, your L&D staff, or even the obstetricians or family practice providers that are going to be giving these bands to the patients, as well as the community organizations, have access to this little training guide. It's a little booklet that they're getting that kind of goes through all of the information so that they don't miss anything when they're doing the training for the bands. Here's just an image of the mini poster. We took exactly the same information that was on the public facing poster and kind of just made it a little bit smaller, but still easy to read, for a reminder for the moms for when they have the bracelet on. If somebody asks them, well, what is this? Why are you wearing this band? What is Palmetto Birth? And they have that information. Everyone, I think, has seen the CDC's urgent warning signs. And so this is what their magnet looks like. And it has the QR code that gets them to the CDC's Hear Her website. This is our little wallet card. The little wallet card, again, has information about what is postpartum, where they can get some additional support and information on the Empower Hub. A place where we can fill out, their delivery information fairly briefly, and it's small so it can fit in their wallet or on the back of their phones. And it also has the link for how they register their bands. So we are asking everyone who is in the pilot program who gets a band to register their band so that they can get, and it's actually 2 surveys. We decided 1 year was too much, so we are doing surveys at 6 weeks and 12 weeks. And the members of the pilot program will be eligible to go into a drawing for a CERSI. When they go to the Empower Hub to register their band, this is the site that they land on, and they just click on register my band, and then they go through and just give some simple demographic information, email address, phone number, how do you want us to follow up, what county where did you deliver, that kind of thing, where did you get your band, and then this is an example of the 6-week survey that the individuals are going to get. We really want to know, are they wearing the bands at 6 weeks? Have they presented to a medical center while wearing the band, and did it make a difference in their health care? So if you want to look at these questions a little more closely, I'm happy to share this information with you. But this IFS is our program that is giving us the support on the data side to be able to collect this information. And then we'll be able to compare the individuals who are similar that did not receive a band, and we're able to go in and look at ED visits, postpartum visits, readmissions to hospital, et cetera. So we'll be able to make hopefully some good comparisons. Other bands that I know of through in other states are not collecting data in this way. So we also will have a plan to survey the EDs that are part of the pilot program as well, to see if they have seen patients and what their response was when they had a patient present wearing one of the Palmetto birth bands. So I think this is our kind of pause moment